Development means nothing if the people's well-being is not taken care of. After all, a healthy and energized public leads to a productive and empowered nation. And this company does just that through the electrification of health centers in grassroots communities. I'm Pinky Webb, and this is the all-new season of Business Matters, where doing good is good business. Electricity is a vital utility in the modern world, energizing all essential services that improves the overall quality of life, including healthcare. But not all enjoy the convenience and advancement brought about by electricity. For a lot of off-grid communities, this service remains a luxury, one that they can only dream of having. The municipality of Concepcion, Iloilo is one of the most disadvantaged areas in the country, with 16 island barangays providing access to electricity and essential health services for their constituents remain difficult.
Itong mga island barangays are places which we considered as GIDA areas, no? Geographically isolated and disadvantaged areas. That is why it's hard for us to service them, not only the health, but also education. There is always a great challenge for us bringing in goods and services in these areas because of inclement weather, bringing services to them. That is why our services for this barangay island is talagang kinukulang kami.
Barangay Polopiña is one of the many island barangays of the municipality that remains off-grid. From the mainland, it takes about an hour or two via boat ride, depending on the tide to reach the remote community. But come rain or stormy weather, the Barangay Polopiña Health Center tries its best to keep the health and medical needs of nearly 4,000 residents in various sitios of the island village in tip-top shape. And ready to serve in its front line are its tireless and dedicated barangay health workers, or BHWs.
Our barangay health workers are actually the health education promotion officers in the barangays. So we were able to equip them with the training or basic health services na pwedeng ma-provide nila sa kanilang level. So for example of these basic services, mga prenatal services, maternal and childhood services like immunizations, prenatal counseling, family planning counseling, consultations, integrated management of childhood illnesses, na consultations that at the midwife and BHW level, they can do it.
Cristina Dumaraog, or Christy to her peers, has passionately served her community as a barangay health worker for more than 2 decades. According to Christy, it was her mother who inspired her to help her fellow island residents as a BHW, particularly keeping the health of children in check.
Yung nanay ko kasi noon, isang kagawad din. Sabi niya, gusto mo mag-volunteer ka para makatulong ka kasi mahirap pag walang BHW sa isang sityo. May mga training din kami para matuto pa kami sa mga bagong mga teknolohiya para sa health ng mga pinapaabot namin sa mga tao.
Despite the glaring challenges faced by a grassroots-level health center, Christy and her fellow BHWs still remain positively committed in giving the best medical service they can to the island's residents, making the most of what they have just to provide care to all those in need.
Kahit na mga sakit na pwede lang namin mabigyan ng first aid, diarrhea, lagnat, nang kaya lang namin silang matulungan. Yung isang estudyante noon na talagang hinika siya. Eh, wala naman kaming magawa, pero Doon binigyan namin ng pang first aid na doon maghinga sa supot ng tinapay.
But modern medicine requires one vital utility, electricity, one that the Island and Health Center lacks. Though their center has the equipment to give adequate and accessible care, Christy and her fellow BHWs still resort back to manual work, unable to utilize their center's full potential.
Gusto din namin makatulong sa mga pag emergency. Kahit yun na lang sinasabi ko sa inyo pag may hika, nebulizer na pwede namin magamit dito. Kasi lahat naman ng tao dito, wala namang gamit na mga generator. Sana dito may kuryente para hindi din kami mahirapan.
The lack of power in the center not only is a burden for the patients, but also for its BHWs, whom all have to adapt and improvise just to be able to commit their sworn duty to the community.
Pag may mga report kami, talagang dito kami sa labas gumagawa. Kasi mainit din ito, hindi kami komportable. Mga 18 kaming BHW, kaya mahirap pag sa loob kami lahat. Yung iba doon nakadapa sa may katre.
Though difficult and often a thankless job, Christy continues to remain positive in her mission to help her community, putting aside all hardships to serve her people.
Iwan ko kung kailan pa ako talaga mag-resign kasi parang hindi ko na maiwan yung mga tao. Minsan kahit na, siyempre may allowance din kami sa barangay, 200. Yung nung una ko palang pasok, 200. Okay na sa akin yun. Kasi marami akong natutunan na makatulong pa ako sa mga tao.
Off-grid health centers like Barangay Polopiña in Concepcion, Iloilo, indeed is disadvantaged. Separated from the mainland, electrification via traditional means may prove difficult, unrealistic even. But no challenge is too great for the country's top power distribution company, who, through its corporate foundation, continues to find innovative ways of energizing and empowering remote communities. Can you tell us more about One Meralco Foundation's electrification program, particularly this new venture?
You know, One Meralco Foundation, when we reorganized the foundation 12 years ago, to really focus more on electrification programs in rural communities. It has brought us to many low-income villages, even within the Meralco franchise area, and energized about 70,000 low-income households, as well as to really far-flung, remote, off-grid communities in the Philippines where we energize initially public schools. We've actually done 290 of those already in a span of a decade.
Providing countless opportunities, whether through livelihood or education. The company and its foundation certainly made impact to off-grid communities energized and empowered by electricity. But seeing how the pandemic challenged the health situation in the country, the foundation saw it fit to evolve the program.
This new venture on energizing health centers has been actually in our plans. But it was, I think, after the pandemic, led us to really focus more into it because of the need of a lot of communities, initially for vaccine storage. And so the parceling challenge was, it cannot be stored in health centers because they don't have refrigerators or storage facilities kasi walang kuryente. That really ignited, we have to do this now. And then when we started to study specifically in very remote communities, which have health centers, hindi lang pala vaccine storage. They needed for nebulizers.
It's true.
They needed fetal Dopplers. They can easily do this if they had electricity.
Seeing the urgency of powering off-grid health centers like Barangay Polopiña, One Meralco Foundation partnered with the local government of Concepcion, Iloilo to energize the center through the use of solar technology, creating significant change to the medical services delivery to the communities it serves. How does electrification help the community, not just the community, the health workers as well?
I think one of the instant results of health center electrification is that the health workers have this certain level of enthusiasm. They have a renewed enthusiasm to work for the community. I'm sure they double up doing overtime just to help these communities. Because now they see their kids being able to, let's say for example, enjoy the benefits of a nebulizer. Pregnant women need not travel across the seas to the mainland to have their babies checked. Especially I think the heart rate. That's why they can now use fetal Dopplers. And of course, the vaccines. Now they can store vaccines in the center and all the other islands surrounding Polopiña.
And with the light provided by the Rural Health Center electrification program comes a renewed sense of purpose for BHWs like Christy, adding another layer of vigor to her passion for serving her community.
Natutuwa lang ako. Matagal na dami ko nang naranasan, sir. Kahit papano, talagang lumakas yung loob ko sa trabaho ko. Kampante yung loob ko. Wala akong iniisip kahit sa bahay, kahit marami akong ginagawa. Pag dito ako, talagang trabaho yung iniisip. Masaya talaga ako ngayon. Pag sa loob kami nagtatrabaho, talagang maipakita namin sa tao nga talagang gumagawa kami. Dagang laking pasalamat na bigyan kami ng ganitong pagkakataon na may solar.
I'm very happy that you have given us this opportunity. So rest assured that our cooperation will be full so that we could sustain this program. And I believe One Meralco as a corporation, I believe also your desire to provide this kind of services to the people, particularly in the far-flung areas, is really timely for us here in Concepcion.
But more than empowering the community, the electrification program also instills a sense of responsibility and stewardship.
When it comes to maintenance, the barangay health workers would regularly check the equipment. Yung barangay officials, they were informed of rehabilitating the barangay health station and with the regular na checking ng solar equipment. Along with that, hindi nila ini-exhaust talaga yung equipment para hindi siya masira. Some of them are also trained on how to maintain the equipment.
How does this mission align with the vision of the parent company?
The greater vision of Meralco is really bringing the benefits of electrification, especially to the marginalized communities. As a leader in the industry, it is imperative for us to use our knowledge, our expertise, our skills, our competencies, even our volunteerism, to be able to extend the benefits of electrification to marginalized communities in the Philippines.
Sana darating pang araw na hindi lang ganito ang maabot ng center natin para yung mga tao ma-akomodar namin ng mabuti.